All right, welcome. I see a bunch of people already jumping in. Thank you guys for being on time. I'm Angela, the CEO of Sunfish. I'm really excited for today's conversation with Vanessa and Danielle. We'll do introductions in a second. So, as you're jumping in, just a friendly reminder, you're going to automatically be on mute. I will be monitoring all of the comments real time. So, on the bottom of your screen where it says chat, you can chat us any questions you have. Um, Let me go ahead and share my screen and we can get started. Happy Monday to everyone who's joining. All right, so today is August 17th. We are going to be talking about financial readiness for your journey. This is great if you're considering IVF, egg freezing, third party, really anything in between. We have a lot to cover today. And just so you get a sense of the agenda, it's only a 30-minute session. We'll be sending out the recording, so don't feel like you have to take notes. I'll start with introductions, and then Danielle, who's the CEO of Resolve, will be talking through an overview on affording IVF and a little bit of information about the landscape today. Vanessa, who runs PatientFi's fertility division, will talk through financial readiness and preparing for financing if you need a loan to move through your journey. And then I'll talk through some of the detailed numbers and the ways in which Sunfish provides protection. We will have time for Q&A at the end. That's the plan, at least. And I'll also make sure everyone has our contact info as well. So really hoping you leave today feeling confident in how to tackle next steps on your fertility journey. All right, with introductions, let me pass it to Danielle to kick off and just tell us a little bit about yourself.
Hi, everyone. My name is Danielle Melfi, and I'm the CEO of Resolve, the National Infertility and Family Building Association. I live in Washington, D.C., and came to Resolve from a career of advocacy and politics and got really excited about this issue and access to fertility care when I froze my eggs several years ago. Thanks for having me today.
Thank you. Vanessa?
Hi, everyone. My name is Vanessa Suker. I'm the channel director for PatientFi. I've worked in the healthcare lending space most of my career. I really understand a lot about the fertility channel due to the fact that I am a fertility mom. Did IVF about 4 times, so really have a very good understanding of what you all are thinking, what you might be going through, especially when it comes to the financial side. So thank you for having me, Angela. Look forward to helping everyone.
Thank you both for being here. I'm so excited to be hosting this webinar with these two incredible leaders. Really, all of our work is focused on trying to make this process more financially accessible for people. So it's a really exciting opportunity to have a conversation with both of you. I'm the co-founder and CEO of Sunfish. I've also gone through 4 egg retrievals to try to build my own family, which is still in progress. And I started Sunfish after having led a previous fertility company and just seeing so many financial and logistical gaps for the intended parents and patients we were trying to support over many years. So Sunfish's mission is to help people navigate and afford their journeys. We create a number of different solutions, and I'll talk through all of that in a second. But first, let me pass things over to Danielle. She is going to give us an overview of the landscape and all of the amazing things her organization does to support. Danielle, over to you.
Thanks so much, Angela. So big picture, just want to give an overview of the work that Resolve does because we can support you at any stage of your family building journey. So we think of the biggest barriers to fertility care are often education. So having the information you need to have a conversation with your doctor to understand the family building paths. So Resolve provides free evidence-based educational resources for people considering treatment. Emotional support. We know that a fertility journey can be really emotionally taxing. So we have free peer-led support groups for those who may need support on their journey, in the midst of their journey. And lastly, advocacy. So we lead work nationally and at the state level to expand access to fertility treatment for anyone who needs needs it. Because one of the things, and we're focused today on financial access. We say at Resolve that fertility treatment isn't expensive. It is just not covered by insurance. We don't talk about a knee replacement being expensive because it's covered. So the work that Angela and Vanessa are doing are really helping to make fertility treatment more accessible for people who need it. Because to take a step back, as we think of the landscape now around access to fertility treatment, access to care really depends on what state you live in, what insurance coverage you have, or what out-of-pocket costs you can afford. So we have the state insurance mandate map, which I've highlighted here, and you can find it on our website, to really show the patchwork of insurance coverage that exists in this country right now. Where I grew up in New Jersey, there's an insurance mandate that provides some level of coverage in New Jersey, but if you move across the border for a job in Philly, you won't have that same treatment available and insurance coverage available to you. So first, always understanding your insurance coverage, what your employer may offer if they do, what is required to be recovered in your state. So every state that has a mandate has a different level of coverage. It may be small group, it may be large group, so can depend on the size of your insurance, as well as your specific treatment journey, whether it's fertility preservation or IVF or full fertility treatment. So what we also really like to remind folks is there's an opportunity to get involved to shape this landscape as well. Resolve provides resources for you to advocate to your employer, to how do you have a conversation with HR? What's the tools and templates to say, hey, I'm someone who needs fertility treatment to build my families. It's not covered by insurance here. Let me tell you why I think it's important, and let me give you some ways that you can go about doing that. So Resolve has resources like that available, as well as opportunities to lift your voice at the state and federal level. Because if your state might not be colored in on this map, that means there's opportunity to expand coverage. So grateful to be with you all today and excited to answer more questions.
And
And
Danielle,
I will pass.
we did have one just come in
Oh,
on the
great.
chat, specifically for LGBTQ families. Can you talk a little bit about how they want to know how this differs for LGBTQ plus families?
Yes, really important question, because even in the states that have some sort of fertility coverage, it really depends on how that mandate is worded. We call it, is that mandate inclusive? Does it include coverage for LGBTQ families or single people who are choosing to be a single parent by choice? So understanding if that mandate is inclusive, if it covers you and your family, and that's a really important part of the care process, because as LGBTQ people are identifying their path to parenthood, there's other steps you may need to take. Whether you need donor egg or donor sperm, there's more steps of the financial process and the treatment process. So planning even earlier is really important so you can maximize your potential to have a family and to have that treatment covered.
Thank you.
With that, I'll pass it over to Vanessa.
Thank you, Danielle. Appreciate it. Like I said, my name is Vanessa Suker. I have worked in the patient financing world for a very long time. Sometimes don't even like to talk about that number, but I am a fertility mom. And I think one of the hardest things for me when we were doing fertility was affording everything. So our son is going to be 12. So it was a really long time ago. And it's amazing to look at the changes that have already come. But back then, there really wasn't any coverage. So it was a lot of it was all out of pocket. And if you think about it, even if you had a little bit of insurance coverage, you still sometimes had all those out-of-pocket expenses coming to you anyway. So while insurance does do things, there is needs for also full coverage. And like I said, I lived in New York City then, and it was a different state then. I know it's so funny if you think about it, it's only 12 years, but there was no coverage back then. So I was all out of pocket. My partner and I were all out of pocket for our four IVF times we did IVF. But we did get our special package at the end. So it was all amazing. And just from my heart to all of you, just keep trying, get out there, keep going. And now I'm just going to tell you a little bit about PatientFi and how we can help you. So our goal at PatientFi is to turn family ready into financially ready. We don't want to see you put this off. If that is egg freezing, preservation, if it's IVF, if it's IUI, if it's anything that you're thinking about doing, I hate when I hear people go, oh, I'm going to wait 6 months. I'm going to save the money. please don't do that. Please don't wait 6 months. Start your journey now, especially if you're going to want multiple children as time goes on. Start your journey. Let companies like PatientFi and Sunfish help you on that journey. So, a little bit about us, kind of the logistics of PatientFi. We approve up to $60,000, so we can cover the entire journey. You might not need that, right? You might just need your out of pocket from what your insurance doesn't cover, which could be $6,000, $5,000. We also do that. What we do is when we approve, we're going to give you this line of credit, right? We call it a digital wallet. Basically, your proof is 60,000, but that's not a loan, right? That's just the number that's out there. And you could use that money throughout your journey. So that can cover your meds, your labs, donor sperm, donor egg, and IVF, IUI, or anything that is an out-of-pocket expense during your journey. Through this entire process, we never do a hard credit check. So the thing that we tell people is go see if you're approved. Find out if you're approved and know that that money is sitting there if you need it, because it's only going to be a soft credit check through the entire process. It's instant. Our application to approval is about 30 seconds. It's very big in the donor world, and I'll tell you why. If you're going to be using a donor, sometimes you have to secure that donor super quick. So we're able to literally apply, transact, and secure that donor in less than 3 minutes. So if you're going that route and that channel, it's something to definitely look at. And then it's quick and easy. The funds are immediately available for you and your doctors or your donor program to utilize. And then we have a plan for every budget. So we do have a no interest plans. We offer them. A lot of the clinics and a lot of the different groups offer them. And then we have extended payment plans up to 84 months that start with an APR of 6.99%. So once you apply and you get approved, it'll show you where you sit. But remember, those interest deferred programs are excellent if you need to maybe figure out, okay, I'm going to pull money from here, but I want to start now. Take that interest deferred thing as you figure out where you're pulling additional funds from. And again, our goal is to really help you. We want to make this process as simple and easy as we can. Our team over at PatientFi speak up to 7 different languages in our corporate office out in California. So if you need to speak to anybody just to discuss this and learn about it, we're more than happy to help you. Trying to think if there's anything else I want to add to that.
Yeah, I did get a question in the chat.
Okay.
I think you touched on this, but just to be super clear to
Mhm.
everyone, they wanted to know if checking options with PatientFi would impact their credit score.
So from start to finish, we're never going to be a hard credit check. So we're not going to, as they say, ding your FICO number. And just so you guys know, we use a lot of different things for approvals. We use Vantage. So we're looking at 85 different factors to help you get approved. So we probably approve the most patient space. So it never hurts to just try, right? Go see if you are approved, see if you have that money, and it'll give you a little bit more security on the back end.
Yeah, that's fantastic. So the soft credit check means you're not getting that hard pull on your credit, which is great. You can be applying to other, like a home equity loan
Mhm.
or whatever. If you're buying a house simultaneously, there's no impact, which is great. And there's no application fee. It's free to apply as
Yeah.
well, right?
There's no fees to you. The only thing you'd ever pay is if you take a loan with interest, you'd pay the interest.
Fantastic. Well,
Thank you.
we love this solution. We've had a lot of shared patients use PatientFi. We always hear wonderful things. Anything else on this section, Vanessa?
I think I'm good. I think we can go over to you now, Angel.
All right, perfect. Well, I will jump in with a little bit about what we do at Sunfish and a little more information. So, in terms of what fertility treatments actually cost, we pulled some numbers. This is really going to vary by your clinic, your state, but just to give people a very rough estimation for a typical IVF and egg freezing cycle. I do love numbers. I love getting into the details. So, egg retrieval, that would be the first part if you're just doing an egg retrieval. We typically see that costing between $8,000 to $17,000, depending on your clinic. And then you're going to need medications on top of that. And there are a lot of discounts and med programs to help with those fees too. So those are going to be your main costs if you're just doing egg freezing, and you can see those numbers added up in the blue line here. If you're then going through a full IVF cycle, the next steps are going to be to go ahead and create embryos. And there's some optional procedures that your doctor can talk to you about involved in that, testing how they're prepared. And then once your embryos are created, you would be paying to transfer them each time, as well as additional medications for the transfers. So a typical IVF cycle is generally between $20,000 to $50,000. I know that seems like a big number, but that's why there's resources like this to help. Similar to Vanessa and Danielle, as I mentioned, I've gone through 4 egg retrievals myself, paid for all out of pocket. While before starting Sunfish as a founder of another company and while building Sunfish. So I am really, really personally passionate about making this more accessible. And a lot of the things that we offer at Sunfish are based on real patient experience from myself and a lot of the people on our team who've gone through it. Just to be super candid with everyone, so this is the cost of one cycle. I'm going to jump ahead. It does take people typically a few cycles to achieve a baby. So everyone's different. Obviously, we hope it will be great, perfect for you on your first try. But just to share some data, this is national data. Again, it's going to differ for you, for your clinic, but based on the age of the female in a journey, this is how many cycles it typically takes to have one baby. So you can see if you're under 35, it's usually 2. As you start to go higher in age, it'll be more than that. So we just like to say that because we want you to be prepared and really be preparing for multiple cycles and just not have those surprises so that you have a full financial plan. So that's really where Sunfish comes in. We are a full support organization that will help you navigate your journey, protect your costs, understand exactly how much you're going to need for the full journey. And if you need financial resources, we work with incredible partners like the 2 organizations on this call, Resolve and PatientFi, to get you those resources. So, and just to talk through what that means specifically, if you wanted to go through IVF with Sunfish, we are national. We would create an all-inclusive package for you that includes your cycle, whether that's IVF or egg freezing. And if you want to finance all or part of that, we actually work very closely with PatientFi. You can take out financing directly through the Sunfish portal. You can also put some on a credit card or pay directly or split that up. So we'll work with you to figure out that plan. You would get assigned a financial advisor here at Sunfish same day that you reach out to us. We actually aim to connect you with someone within 5 minutes, and they're going to help you throughout your whole journey until you're holding a baby in your arms. If you have some employer benefits, we can incorporate that too. If you have savings, we can incorporate that. We'll help you figure out if you have any medication discounts. And we also have grants and discounts as well as our own financial care program called Sunfish Cares that all work together to help make the cost more affordable. So typically when working with Sunfish, we see patients save up to $9,000 per cycle, which is something I'm really proud of. And on top of that, we'll be working with you logistically to give you all of the resources you need and guidance to really put your best foot forward. So we actually see our patients have a higher pregnancy rate and a higher success rate than national averages by about 40% more, which is pretty incredible. So we will be with you for every step of the way. In addition, we have a tool that helps you prepare earlier called Sunfish Starts. So if you come to our website and you're still a few months away from starting your journey or earlier in your journey, we're going to help you navigate all of the steps associated with getting set up too. So that means any testing you need, we'll work with you in your clinic and start really working with you to develop that financial plan earlier. So loans like what PatientFi offers are really best in class, and we want to make sure if you are taking out a loan, you're able to put your best foot forward there. Or if you're using other resources, we'll put together that full financial plan. And we have a number of discounts on things outside of your IVF cycle too, like mental health coaches, nurses that can come to your home depending on the city that you're in, multivitamins, etc. So it's really comprehensive. And our goal at Sunfish is to be that full support planner as you go through your journey. Just like if you were buying a house, you'd have a real estate agent helping you navigate everything and get your loans and get everything in order. That's kind of what we wanted to do. I feel like when I was going through IVF, I felt like an unpaid project manager and it was almost a full-time job. So we offer that for our members. So we'll talk a little bit about how you can find us, but I see a few more questions came in. So let me stop the share so you can see us, and I will jump into those questions. Vanessa and Danielle, anything you want to add as we dive into Q&A here?
Angela, when you just said that, it brought back, and it's true, right? It's so great that Sunfish does that for your patients because you're like managing a project.
Yes.
Like I remember spreadsheets and this, and who
Mhm.
do I call about that? So it's just such a great thing to help people that way.
Thank you. Yeah, it's a flat fee, all inclusive, so you know exactly how much you're going to pay, and then everything's kind of coordinated for you. Well, we got one question for you, Vanessa. There's someone wanting to know a little bit more about the zero interest loans that you have. Can you share a bit more about the term length and conditions for those?
Yep. So the main one that's used within the fertility space is a 6 month. So it's a 6 month no interest. As long as it's paid within that 6 months, you will never pay any interest on that. It would, if you were unable to, it would roll into a 48-month term loan. But we know that within the interest-free world, as long as you know you could pay it off in that 6 months, it's a great product to utilize. Especially maybe you're getting a bonus or a tax return at some point, right? And you know this money's coming, but you don't want to hold off starting your journey. And I think that's the key. I'm such an advocate of don't wait, please don't wait, because I did wait and it becomes even more difficult. So we like to call it it's a helping step, right? That six
Hmm.
months is a helping step to get you to where you need to be.
Okay, great. A bunch more questions coming in. One was for Sunfish. So the flat fee personalized bundles, they want to know the costs. That's going to depend on you, your treatment plan, your clinic. I believe our egg freezing packages start at $8,000 and our IVF packages, I believe, start at $16,000, but it's going to be personalized for you. So feel free to reach out to us at joinsunfish.com and we can set that up for you. Danielle, we got a question wanting to know how someone can learn about the policy in their specific state.
Yeah, so you can sign up for Resolve's Action Networks. You can find that on our website. And what we do is if you share, you kind of fill out your information, you share your zip code, and we will notify you when there's bills that are actually moving in your state. The legislative process is like long and wonky, and not every bill becomes a law. But we do all the monitoring. So you just have to know, hey, if you've signed up for the emails, we'll let you know when there is a hearing for a bill or a bill is moving to committee. And that's the time when you can take an action. And when it's really important to have patient stories lifting up why it is so important for a bill to either expand coverage or to fight a bill that restricts coverage. And that's unfortunately, we're seeing more of that in this political environment. So sign up and we can keep you in the loop and do the work for you.
Okay, great. Question for Vanessa. If someone is in a mandated state, she wants to know if she would still use financing.
So there are, when you're in a mandated state, sometimes, some of the meds aren't covered. Sometimes genetic testing isn't covered. I don't know, Danielle probably knows this a lot better than me, but there are sometimes things, even with a mandate, that aren't covered. So you
Yeah.
can utilize your patient-fi line of credit for any of that. We do a lot up in Massachusetts and New York and New Jersey, and these are states that have heavy, Massachusetts especially heavy coverage. And we still have patients that have some out-of-pocket expense, and they'll utilize like that 6 month no interest for like that $1,000 out of pocket that they have. So yes, you can utilize it for that too.
Fantastic. Okay, great. Then got a question for Sunfish, so I'll take that one. if we can explain more how we would work with their clinic to put together the package. So we're going to work directly with your doctor once you go in for your fertility assessment, or even before as you're starting to plan. We'll work directly with your fertility doctor to understand your treatment protocol, and that will determine your personal package. There's also some choices you can make around what you want included. For example, if you want a multi-cycle package with more than one retrieval, that will all be customized based on you and your treatment protocol. All right. Another question, um, for PatientFi, if you're financing, can you use PatientFi to pay for things other than IVF, like medication or genetic testing?
Yes, you can. So that's the great part about the line of credit, basically, that digital wallet, right? So you're going to have that money. So let's say you do your IVF cycle and everything's getting organized, and then you realize, wow, my meds are going to cost a little bit more than I thought, and that happens often. You can utilize that line of credit. We are pretty much with every pharmacy within the fertility space. Same thing with genetic testing. If you decide you want to do that and it was after the process, that's what makes our product so great because it is a line of credit. You can now in turn utilize that within the company that you're doing your genetic testing with.
Fantastic. Yep. And if you're working with Sunfish, you can work with PatientFi as well as part of the Sunfish package. We'll help you coordinate medication, get discounts there, genetic testing if you need that, really everything that's part of your journey, including all the things I mentioned outside of your treatment costs, like mental health support, multivitamins, nurses coming to your home if you want to add any of that. All right. So obviously, there's more and more employer benefit coverage now, which is great, thanks in part to the advocacy work that Resolve does. Danielle, if someone does not have fertility or family building benefits through their employer, do you have resources, talk tracks? This person wants to know anything like data they can bring to their HR team?
Yes, so we have what we call at Resolve coverage at work, and that is our program where we help train people on how to advocate to your employer. So we provide a template email that you can send to HR. We provide some talking points and resources of like, oh, great, you got the meeting scheduled. Like, what data do you want to use, and what can you come back to? So we have all of that information available to you, and we also offer coaching. So a member of our team has done this for several years with one-on-one support for both employees and employers. So you can find this on our website, and a member of our team will be in touch to help talk you through it as well.
Okay, great. I got two more questions. One for Sunfish. They're saying, I think I have partial coverage through my husband's work. Can we still work with Sunfish? Generally, yes. Our team will talk to you to see exactly what you have covered. But we have certainly worked with different employer plans in the past, like Progeny and Maven, or different types of medical insurance, depending on what's covered. We usually have some flexibility in terms of how the package is designed and what you're paying through Sunfish versus what your benefits are covering. So definitely still reach out to us. And then someone else asked if I've already completed several cycles, can I still qualify? Absolutely. If you have not been successful before, I think everything here on this call can be a great resource for you. Sunfish supports a lot of people that have had an unsuccessful cycle in the past and they want that additional support, guidance, savings. I know PatientFi will work with a lot of people after their benefits have run out. They're looking for additional financial support. So we would all be excited to help you. Okay, let's see. These are great questions. Thank you. Keep them coming. Um, One more question in terms of internationals. So if you live outside of the US, Sunfish can work with you. We have a lot of people that are not US based who want to use those flat fee packages and the savings and discounts that we negotiate. Vanessa, do you want to speak to that from a financing perspective?
Yes, financing is weird in the United States. Pretty much all financing companies don't finance outside of the US. But if you did live here and have a tax ID or are able to get a social security number, then we would. You could have dual residency, it doesn't matter, but you'd have to have a social or a tax ID to apply.
Mm-hmm. And then a last question on third party. So if you're working with an egg donor, sperm donor, surrogate, yes, Sunfish can support packages for that too. And I know that PatientFi offers financing for that. We absolutely love working with PatientFi. And if you're looking for financial support beyond that $60,000, we may be able to support after you've worked with PatientFi too to get up to a few $100,000 through some other support systems. So definitely reach out to us for that. I'm going to cut off the Q&A just because we only have a minute left and I want to make sure everyone can find us. So we'll share our contact info after this discussion over email. And Danielle and Vanessa, do you want to just share the best way for folks to reach out to your organizations?
For Resolve, you can do info@resolve.org, and the appropriate member of our team will be in touch and get your question answered.
Very similar info at patientfi.com. You can also go to our website and submit if you have questions. Our customer service team, like I said, they will answer anything you need and they will reach out to you very quickly.
Fantastic. And at Sunfish, we're also info@joinsunfish.com, or you can visit our website, joinsunfish.com, and click on Get Started. So with that, I could not be more excited and honored to have this conversation with the two of you and all the incredible work your organizations are doing. We're really delighted to partner with you to support patients. And for everyone listening, we'd be so honored to help you on your journey. Any final comments from you, Vanessa and Danielle?
Well, I just keep fighting for it. It will all happen, I promise you.
Yeah, just sending love your way to anyone on their journey right now, and the folks here are here to support you on your way.
All right, with that, I will end the webinar. Thank you guys all so much for joining, and we'll be following up over email.
Thank you all.
Thank you.